My name is Monica Davare. I am a research scientist and faculty member at Oregon Health Sciences University and Dornbecker Children's Hospital. I am very grateful for the support by the Pediatric Cancer Research Foundation for my work. My lab is interested in dissecting the molecular and cellular mechanisms that drive pediatric brain tumors. Brain tumors are the leading cause of cancer-related deaths in children. Currently, the common treatment options include cytotoxic chemotherapy and radiation. The problem with these treatments is that not only do they often fail some patients, but even the survivors are left with lifelong debilitating consequences. The motivation of my research group is to identify these molecular pathways that drive tumors in order to enable the development of selective targeted drugs for children with brain tumors. In kids, medulloblastoma is the most malignant brain tumor that leads to fatalities and health-related consequences. With the advent of genomic sequencing technologies, researchers are very easily able to identify DNA mistakes or mutations in tumor genomes. The result of this is that we have a preponderance of genomic data, but often no real development of new therapeutics. The bottleneck, in my view, is that DNA sequencing often gives you information on which gene is mutated or has the mistake. However, many of these mistakes are simply passenger events and only a few of them are true drivers of the cancer. Our lab is interested in identifying which one of these mistakes is actually a driver versus which one is a passenger that we shouldn't waste time developing drugs for. In medulloblastoma, a similar bottleneck is stalling therapeutic development. With the funding that the Pediatric Cancer Research Foundation has provided us, we aim to experimentally parse which mutations in a class of genes called kinases is a passenger versus a driver. The reason kinases are an attractive genetic entity for us is that the pharmaceutical pipeline is ever expanding because kinases also play a role in adult cancers, and the drugs are readily available and orally administratable. We are confident that by dissecting using stringent experimental biology, these kinase mutations in medulloblastoma will eventually lead to novel therapeutics so that we can not only improve survival rates, but also give the survivors their full potential and quality of life. Thank you very much, Pediatric Cancer Research Foundation, for your support.